Hello, we are Group 13. Today, we will be presenting about folate antagonists. Firstly, let us introduce ourselves. My name is Sherlina.
I'm Ines.
I'm Hariza.
And I'm Sakina.
Now, we will begin our presentation. First, let us take a look at the folate synthesis process. So this concept map shows the folate cycle. We first obtain folate from our diet. Folate is an important vitamin that is required for several processes in our body. So the first process is the thymidine synthase, where in this process we will get pyrimidine, which is an essential in the formation of nucleic acid. The next process is the purine synthesis. Purine and pyrimidine have the same function, and that is to become an essential in the formation of nucleic acid. The next process is the methylation cycle. This cycle is a biochemical process that converts nutrients that we consume.
Now, let's get into inhibitor of folate synthesis, also known as non-classical antifolate. Firstly is mechanism of action. This drug is competitive inhibitor of dihydropteroate synthase. It inhibits dihydropteroate synthase by entering the enzyme's PABA pocket, and then it will preventing PABA from entering the reaction site, creating an analog that is unusable as a substrate in the folate cycle subsequent reactions, and this will cause significant decrease in folate level. There are two examples of this drug. Firstly is mefenite. After a severe burn, the wound becomes the perfect environment for bacterial infections as there is no epidermal protection. So, we use mefenite ice creams to treat wounds. This drug is active against a wide range of gram-positive and gram-negative bacteria such as Clostridium species and Pseudomonas aeruginosa. Mefenites give some adverse effect to the patients like allergies, skin irritant, and systemic metabolic acidosis. Next is sulfadiazine. This drug used to treat infections of the urinary tract and used for the treatment for some parasitic disease like malaria and toxoplasmosis. And this is very useful for the prophylactic treatment for rheumatic fevers and also used in the treatment for the bacterial infections including severe meningococcal meningitis, otitis media, and encephalitis. Sulfadiazine have a broad spectrum activity against most gram-positive and gram-negative bacteria. And then this drug also gives some adverse effect to the patients like gastrointestinal upsets and also the renal failure. For the pharmacokinetics, this drug will absorb after taken orally and it will undergo metabolic pathway in the liver. Then it will distribute it through the body tissue and also enter the other body fluids like eye. And then this will excreted mainly in the urine by glomerular filtrations. Need to remember that these drugs are easily transferred from the placenta into the fetal circulations and also absorbed by the child through the breast milk. So this drug need to avoid from the pregnant and also breastfeeding mothers.
Now, let's look into the inhibitor of folate reductase. Its mechanism of action is that it will inhibit dihydrofolate reductase, which prevents cell from converting dry hydrofolate to its active form tetrahydrofolate. Tetrahydrofolate is important for the formation of certain components which is needed for DNA synthesis, and thus it will disrupt cell growth when depleted. Some examples of dihydrofolate reductase inhibitors are trimethoprim, pyrimethamine, proguanil, and trimegrizate. Trimethoprim is similar to sulfonamides in its antibacterial spectrum, but it is more potent, so it is often used alone to treat urinary tract infections and vaginitis. Trimethoprim is readily absorbed and widely distributed through the body, including the cerebrospinal fluid. Its half-life is 8 to 10 hours, but may prolong in patients with renal failure. 80% of this drug is excreted unchanged in the urine. Some of its adverse effects include folic acid deficiency, fever, nausea, vomiting, and also maculopapular rash, which is bumps on the skin and discoloration of some areas. Patient taking this drug should take it with food and report to your doctor if experiencing severe side effects such as unusual bleeding, fatigue, sore throat, and prolonged fever. Pregnant or nursing women should take trimethoprim with caution since it can cross the placenta and breast milk. Some dose adjustments need to be done for patients with renal failure, and since it can cause folic acid deficiency, patients already experiencing this problem should also be cautious when taking this drug because folic acid deficiency can lead to megaloblastic anemia.
Next, we're gonna talk about the inhibitors of folate synthesis and reductase. Cotrimoxazole is the drug. It is a combination of antibacterial effect therapy of two antifolates, which are trimethoprim and sulfamethoxazole. Firstly, trimethoprim is a primidine that inhibits DHFR, while sulfamethoxazole is a sulfonamide which inhibits bacterial DHPS. Inhibiting two almost related reactions of the folate cycle cause it to have a synergic effect when used together. Its side effect could include cutaneous eruption, exanthemas, hyperkalemia, and hyperglycemia. However, it is safe to use when pregnancy because it is a pregnancy category D drug, which means it is safe for pregnant mother as its benefits outweigh the risk towards fetus.
That's all from us. Thank you very much for listening to our presentation.